Well, hello and God bless you. I'm James Jackson. We have a wonderful show. This is our inaugural show, Real People, Real Voices. I'm co-hosting with Dr. Moore. I tell you, I think it's going to be an excellent show. It's going to be a blessing to a lot of people.
I believe it is. I believe we're at the right time, at the right place, doing the right things to make Indianapolis a better city. We're going to come with a lot of information, hopefully that the city of Indianapolis will enjoy it.
There's a lot going on in our city, as with a lot of cities across America. You know, one of the things, certainly we're both pastors, and you know, the Bible says in Jeremiah that we're to work for the peace of the city. And when the city has peace, we will all have peace. So we got a lot of work to do.
We do. And today we're going to start doing that type of work.
So we got some great guests here with us today. Dr. Virginia Kane, she is director of the Marion County Health Department. We also have Dr. Michael Twyman. He is executive director for Opportunity Indy, formerly known as Your Life Matters. He's going to be sharing some things. And the theme of our show today is mental health.
Yes, it is. We have a great issue in our city with mental health, and I think we have the right person here to talk about it.
Yeah.
She's our medical icon in the state of Indiana, and we're so happy to have her for these moments today at this inaugural show.
Yeah, so Dr. Kane, welcome to the program.
Well, thanks for having me.
Happy to have you.
John.
Yeah, Dr. Twyman, thanks for being here.
Glad to be here. Thank you so much.
Yeah. So I think that as we get going here, we want you to tell all your friends about this show. This is our first show, Real People, Real Voices. And we want to make sure that we're working on the issues that concern you in our community. And we want to hear from you as well. You can email us. You can email me at pastorjamesjackson@gmail.com, and I'll share that information with Dr. Moore.
Yeah, you can email me at morewayne13 at 13 Wayne Moore 13 yahoo.com.
And certainly you'll share that information
Yeah,
with
I
me.
will.
All right, so stay tuned. We're going to have a wonderful time here on Real People, Real Voices with our very special guest, Dr. Virginia Kane, Marion County Health Department, and Dr. Michael Twyman, Opportunity Indy. We'll be back after this.
Real people, real voices, keep it
Well, welcome back to Real People, Real Voices. I want to get right to the issue of mental health. Dr. Kane, there's a lot going on with regard to mental health across America. In fact, right in the city of Indianapolis, is my understanding, we have a lot of folks who are in Marion County Jail that have mental health issues. It had been said that of those who are incarcerated across America, more than 30% have mental health issues. Talk to us about how we can solve the problem.
Well, first, I really need to make it clear that we did a community-wide needs assessment. We do it about every 5 years. And we were shocked to see the amount of mental health in our community. When we were looking at our young 18 to 25-year-olds, 50% stated that in the last 30 days, greater than 15 of those days, they were so depressed they couldn't carry out their normal activities. This is 50% of our young adults. That's incredible.
What are you doing, Dr. Kane, as it relates to trying to eradicate those issues that you've discovered?
I think the thing that we're recognizing is that this depression starts earlier. So when they're in their 12, 13, and 14-year-olds, we're even higher than the national average at that time frame. And so they don't always get the help at that age group. And so then they start self-medicating themselves.
Right.
And that's how we get into this opioid dependence, drug abuse, and whatever. So we have to recognize the symptoms early. And we can't be concerned about the stigma.
Right.
You know, mental health is just like heart disease, diabetes, okay? You have a deficiency in a certain neurotransmitter that can cause you to be depressed.
Well, that's an interesting fact there you give.
Yes.
That mental health is akin to heart disease.
Right.
But a lot of people don't look at it the same.
Well, you know, the brain is the most important part of your body because it directs everything. It's the most important part of your body. and yet we don't treat it like it's special. But it is the most special part of your body. I mean, you can't get up in the morning, or you can't drive, or you can't bathe yourself, you can't read your Bible unless that brain's intact.
So if we're not functioning
But
mentally,
it's a chemical deficiency that you can replace with medication to help you improve your behavior and your mood.
So, and you're talking about the self-medication, particularly among young people. These are folks that are going to school. These are folks who are in college. And if they're self-medicating, do you think that that's contributing to some of the young people, particularly in the black community, who may be ending up in the correctional system?
There's no doubt about it. And a lot of these individuals, they need medical care and they need health professional care. The folks that are in the jails require law enforcement. And they're not really trained long-term and have the type of facilities that they need in order to treat these individuals, because they're just going to get out and be re-incarcerated again unless they get the necessary behavioral modification and medications that they need. Now, a lot of jails do have mental health services available to them to try to help this problem, but that's not the facility to treat someone with mental health. You know, really get it to the hands of the people who are the best in the business in doing this. And the earlier you intervene, the better your success rate.
let me ask a question. So what do you suggest as it relates to those who are already incarcerated, who are under the, who have mental health issues? How do we improve that?
Well, I think we've been fortunate sometimes in the past. We've had certain judges that have recognized that when they're incarcerating someone, that this person has a mental health disorder and that they need that help, and they will make that happen. And then, of course, the jail system tries to interview every single individual, do an assessment, and try to determine if they have a mental health disorder. But you know, you can't underestimate folks who have a mental health disorder. They're very smart. They can sometimes fool you in an interview and that you don't know that you have a problem with this person or that they may be suicidal. You can't always catch it. You know, they're not dummies by any means. So it's over time. This is where family and friends are so important, because they may see that type of behavior, but the patient is not telling the health professional provider, so he thinks that the patient may be okay and not harmful to themselves. But mom says, oh, she set the house on fire last night because she thought the devil was trying to get her. Or she took the knife out of the drawer, and I was concerned she was going to harm herself because she thought the devil was going to get her. So those patients may not always tell that to their provider. So this is why family members got to be there to tell that story.
The silence, though, Pastor Jackson, in mental health is becoming, it has been, but becoming more of an issue now. And Dr. Kane, what do you do to get families to break the silence of mental health in their own household?
Well, I think we really need your help. So we need to make this just like any other medical disorder. And we need to recognize those symptoms in our family members, what they are. Someone has a favorite object, a toy, a basketball or something, and all of a sudden I'm a young teenager and I'm giving it away to my friend. That's like a red flag. You know, he may be starting to commit suicide. And then we just don't want to think our child has any problems, you know, and so counselors may be telling you and you just blow them off.
That's interesting, Dr. Kane, because a lot of people, when you start talking about mental health, and in fact, I don't think people like to use the term mental illness. And if you have a heart disease or an illness, we're okay with that. But then when we start talking about mental health, there's a stigma there. And how do we help people with that to get over that?
We want to tell people we want a healthy brain.
Right.
So how do we get to that healthy brain? What do you need to have in terms of a healthy brain so that you can carry out normal actions, be able to go to school, go to work, do those things that in terms of food and nutrition are important for you. So start talking about the healthy brain.
Even though it needs medication.
It may require medication, yes.
yeah.
Exactly.
So here on Real People, Real Voices, we certainly want to make sure that those of you who are in our viewing audience know what your options are to get some help if you need the help. So we want you to stay tuned right here. We have Dr. Michael Twyman that's going to be coming up. Certainly, Dr. King, we thank you for joining us.
I appreciate this.
Yes, ma'am.
Hope you
Happy to
come
have
back.
you.
Well, thank you so much.
Will you come back? Will you come back?
Oh, definitely will come back,
All right.
okay? But don't let Dr. Twyman steal my thunder.
Okay.
Okay. All right.
So stay tuned. We'll be back after this. Welcome back to Real People, Real Voices. We want to get right to the issue. We're talking about mental health in the city of Indianapolis. And certainly, it's not just an Indianapolis issue. It's an issue that is a concern across the entire nation.
You're right, Pastor Jackson, and it just so happens the city of Indianapolis is at a point now where it's becoming crucial, and we got to do some things to help our community, along with those who are involved professionally.
Yeah.
And to see the faith-based community come together and work with those who are in mental health and the professional end of it is great. And we got some things coming up, and that's why we have Dr. Twyman here. He's
Yeah.
going to help us look at some things, and hopefully we can help him.
So, Dr. Twyman, from your point of view, how do we overcome this mental health, I want to call it a mental health crisis?
And I guess maybe we could consider it a crisis. I want to pick up with where Dr. Kane left off, and of course, she being the medical doctor that she is and a good friend, I think she was right on. And when she speaks specifically about having a healthy brain, and if we could look at that from a different lens than we have in the past, because I think we do use terminology often interchangeably. We'll say mental health when oftentimes we're talking about a mental disorder or a mental illness. We all have mental health. And if we think about our overall health and think about the brain as the central component, as Dr. Kane said, that really controls everything else. And so we want to make certain that we have the healthiest brains possible. And a lot of that really focuses on early brain development in children. We know that nutrition, the exposure to reading, other types of stimulation, both in the womb and a few months and years out of the womb, make a big difference in terms of how the brain develops. And so we have great research out there now that gives us better insight and knowledge about how we can, with younger children, and even before they're born, start to program their brain in more healthy ways. But it also goes into issues of access, information, resource, and knowledge, so that mothers and fathers have the information that they need in order to be good stewards, to be good parents, but can be just as invested in developing the whole child, both mentally, physically, spiritually, and intellectually. And all of that really stems from the brain. The work that we do at Opportunity Indy, which is a focus on young African American men here in Indianapolis, really dedicated to improving the life outcomes of young men from the ages of 14 to 24. When you look at the issue of mental health and you look specifically at oftentimes what goes on, often ignored, both, I think, in school settings, but also in community settings and in the home in terms of certain behaviors. And oftentimes they get mislabeled, and then they become self-fulfilling in terms of what people expect of the behavior. We know that there's a correlation between attention deficit disorder and how then students are labeled in terms of special ed. We know the high numbers of young African American children that are in special ed courses. There's a high correlation between them, between those individuals and expulsions and suspensions. And so when we start young with kids, either in terms of labeling them, and oftentimes mislabeling them, but not getting them the support services and resources that are needed that will allow them to be at a higher level of functioning, we're setting up the course of, one, being able to not make good choices, but also being detached from the systems of home, school, and community that should be acting as supports as opposed to as detriments or deterrents. And so what oftentimes happens for a lot of young African American men, they turn to the street.
Now, you mentioned a lot of young people are mislabeled. And certainly in a lot of our schools, particularly in Indianapolis, a lot of our young people, particularly African American males, are on medication.
Yes.
So how can parents make sure that when they take their children to the doctor and they're evaluated, how can they make sure that their child is not mislabeled?
Right. Well, I think it really is a team approach because not only do parents need to be well informed, but the school needs to be working with the healthcare profession, with social workers, and as a team or united front around looking at all the issues that may be impacting a young person, so that medication may be the appropriate remedy in certain instances, but that too has to be determined in the context of a number of other factors. And so I think, somewhat times trial and error, but again, I think if we don't have the conversations, if we are fearful of even going to a therapist or a mental health professional, then that's all foreign to us. And so I think a lot of it, as we've mentioned, is trying to reduce the stigmas, looking at mental health as just a part of our overall normal development and well-being. The suicide rates among young African American men here in Indiana are really abysmal and are getting worse. And I think that's just kind of off the radar. Most people don't know that.
Let me ask you something, Doctor. Do you think we are behind the 8 ball with mental health? That do you think we have time enough to capture it and move it in a direction that can be more positive for the community?
I think we can start stemming the tide. I think we got some work to do. We are probably behind where we need to be as a community. But I think with the resources that we have here, the goodwill, the great institutions, and the brain power, no pun intended, amongst many of the professionals and individuals in our community, we can start moving forward with, I think, a more comprehensive solution and strategy about how we look at mental health issues, not only in the larger community, but how it relates to and plays out and manifests itself with certain populations. African American men's issues are unique, and as every segment of our population. And so we need to find ways that we provide services and interventions that are culturally specific and competent and are relevant to the folks that we're trying to serve.
In a nutshell, in the few seconds we have left, are we getting enough resources from our city to deal with the problem?
Well, like everything else, I think we're still working in silos. So I think we need to be talking across sectors because mental health issues and mental disorders manifest themselves in the workplace. They manifest themselves in the home and in the community. And so I think, law enforcement needs to be talking to the health profession. The health profession needs to be talking to the school system. The school system needs to be talking to the home. So we just need to come together and use what resources we have in order to move in a more efficient manner.
Well, thanks for being with us. We appreciate it. Hope you'll come back. We want you to stay tuned. We'll be back after this.
Thank you so much.
Real people, real voices, keep it real.
Welcome back to Real People, Real Voices. And Dr. Moore, we had a good segment talking about mental health.
Yes, we did. I think we got some information. We've got the right people in here talking about the right things and the right situation that will help the community. I think we've got to tackle this issue and we've got to be proactive. Dr. McCain and Dr. Twyman gave us some great information. I think we need to utilize that to the best of our abilities.
And this is our rundown segment.
Yeah,
And
yeah.
what that means is we kind of talk about the solution. We have the guest on, we talk about the problem, but the solution. So one of the things I do know is that for those of you who are watching, you can dial 211, and 211 is a number that will connect you to resources to help you not just with mental health issues, but a lot of other things that you might need. You can also go to 211 Help online. And Dr. Moore, I found that the online has a tremendous resource as well.
It does. It does. I think that out of all the things that have been done recently, that addition was a great addition to the city of Indianapolis to help those who are in crisis at any given time. And I think with this mental health issue on the rise, that number is going to come in handy.
Now, with regard to other resources, Dr. Kane talked about the young lady who said, the devil's after me.
Right.
And the church, when we talk about the church, how does the church come to this? Because over the years, as you are aware, and especially among black people, when it came to mental health issues, we equated that with demonic influence.
Right.
And we said, we can just cast the devil out. And yet, Dr. Kane and Dr. Twyman are saying, well, there might be some medication needed.
Right. And I think when you hear people talk about medication, a lot of people become embarrassed because they don't have total control of their faculties, and they have to have something to alter them, to bring balance to them. But the church, going back to your original statement, the church, I believe now is ready to get involved. I believe it's going to do some things as it relates to informing the community. Dr. David Green of Purpose of Life Church, along with myself, Concerned Clergy, the Baptist Ministers Alliance, are going to be creating some forums in the city of Indianapolis that will give information to all who will come and partake of it to get help in these areas of mental health. And I think the Far East Side is we're probably going to start out there first with a forum.
Yeah, and that would be good because we have a lot of food deserts out there.
Right.
And Dr. Twyman talked about the fact that nutrition is an important factor in making sure we all have healthy brains.
Right.
And if our children are not getting a good diet when they wake up in the morning, if they're not getting nutritious meals, that's a problem.
And I guess you need to be commended for that, because our job program, which starts Friday, we make sure that young people have a decent meal before we go out to work every week. And it's very important. You'd be surprised at the young people who don't have food in the mornings before they go to school. And it's a part of mental health. It's a part of nutrition for mental health. And I think we need to do what we can to eradicate that as quickly and soon as possible.
And what's also encouraging is that IMPD, they're working on some solutions to how they engage people out in the community who may have some mental health issues. We had a young man who he was having a mental health challenge, and subsequently he was killed.
Right.
And so there's training, and there's talk about more training in place to make sure that these things don't happen.
Well, we hope that that will take place. And I think with all that is being done, I think we'll be able to be instruments to make sure some of that gets done in our community.
All right. So we want to make sure that you are with us each week. Please tune in every Wednesday at 11 o'clock p.m., every Sunday at 6:30 p.m. for Real People, Real Voices. And we're just really glad that you joined us.
Oh, yeah. This is phenomenal.
So please tell all your friends, family, associates, and neighbors to tune in every week. We're going to set up a Facebook page. You're going to be tremendously blessed as we help solve the problems in our city. We'll see you next time.
Thank you.